Hello, everyone. I'm Rebecca Weber, and you're watching Better for America, presented by AMAC, the Association of Mature American Citizens. I'm delighted today to sit down with Dr. Ben Carson, a man whose journey from a celebrated neurosurgeon to a political leader has always been fueled by a deep commitment for his passion for community and country. Dr. Carson's thoughtful perspectives always shed light. Dr. Carson, thank you for being with me today. It's an honor.
Absolutely. My pleasure. Thank you for having me.
Thank you, sir. Now, you've spent recent time discussing new drugs for Alzheimer's patients. And I thought to myself, boy, as a retired neurosurgeon, you must be keeping yourself very busy these days. But Dr. Carson, how serious is Alzheimer's as a condition here in America? And how do you see some of these drugs changing the course of Alzheimer's treatment?
Well, obviously, it's a big problem because our population has aged, and it's a problem of aging in which you develop these amyloid plaques, which sort of act like barriers between the neurons and their ability to communicate with each other. And they actually form physical barriers, these plaques and tangles. And some of the new drugs that have been introduced within the last year really show promise in terms of actually interfering with the formation of those plaques and tangles. In the past, the things that have been used for Alzheimer's have just been aimed primarily at the symptoms, but this is actually going to the heart of what seems to be producing the neurological manifestations. So it's promising, and that's why it's been put on an expedited track. Uh, some of the trials could be finished within the next year to a year and a half, in which, uh, and of course, there are a lot of people who are applying to be guinea pigs. They want to, because what's the alternative, really?
Certainly. And, enhancing quality of life, that is definitely a concern for many of our AMAC members. And it's a shame to really, when you realize how many people in this country have been impacted by the disease, whether a loved one, a family member, a friend, or even they themselves that are going through this. So that's very promising to hear that maybe a year and a half out, there will be real strides being made to address the issue. But when you take sort of the wider look, what do you think are some of the biggest challenges facing the U.S. healthcare system today, specifically really ensuring that our seniors can receive the care that they deserve, but also that they can afford it? We know that it's very expensive in America for good healthcare.
Well, we're spending an enormous amount of money on healthcare. $13,100 per capita per year. Now, most of the concierge practices only require $5,000 to $10,000 a year. Just to put that in perspective for you.
Mm.
Uh, so, what do you need for good health care? You need a patient and you need a healthcare provider. Along comes the middleman to facilitate the relationship. Now, it has become the dominant entity, dictating to both of the other components. Uh, you're never going to have, efficiency in a system like that. And right now, our system is sort of like you go into a hotel, put your credit card down, and they say, "Oh, you don't need a credit card. All the charges have been taken care of." Oh, well, give me the room service menu and all the other things. Whereas if you have to pay for it, you're saying, "Is there a McDonald's around?" You know, uh, there's no personal responsibility in the system as it exists right now. And if you have things like health savings accounts, for instance, where patients have real responsibility, then when the doctor says, let's do another CAT scan. I know we just did one last month, but just so we can, you're going to say, sir, do we really need that? And most of the doctors are not going to ask you to do another one anyway if they know it's coming out of your account. So, those are the kinds of things that put checks and balances into the system, and that will somehow keep control of it. And there are a lot of modifications to the standard health savings account system that we could utilize. For instance, allowing family members to shift money from their HSA to another family member who needed it at that time. And then if you don't use it, allowing it to accumulate year over year, pretty soon, if you're healthy, you have a lot of money. And even if you don't use it, you can use it for somebody else in your family. And when you die, you pass it on to your family. Within a couple of generations, just about every family would be its own insurance company.
I love that idea. We've got to do a couple things here. I think that's healthcare price transparency. We as people have got to fight for that because we know that if we let the free enterprise system work for itself, it'll take care of people. It always does. But we need
Yeah.
healthcare price transparency, as you said, so people understand what they're paying for. And instead of just paying that huge insurance premium each month, understand what you're paying for, what you're getting. Very, very good, very important. Dan Weber, founder of AMAC, was a huge proponent of keeping government out of the exam room. And we see, more and more today that government is expanding and looking to essentially take over our healthcare system. So here at AMAC, we're always looking for those great solutions. And I love the idea that you've shared about the HSA being able to pass on to family members and accumulate wealth if you, in times where you don't need to tap into that fund. Sir, I
Yes.
want to shift just a moment and talk a little bit about the pandemic because it really presented unprecedented challenges, especially around the country's preparedness and response. And I do think that during times of crisis, these scientific experts become crucial. But I think that we're sort of living in an age where this mantra of trust the experts is really starting to be questioned. Many people are now saying, okay, who are these experts? What's really their track record? How would you grade, sir, the medical and scientific field in shaping public policy decisions over the last, say, 3 years?
Well, pretty terrible. It would be a failing grade. And the result of that is that people have lost tremendous amount of faith in our public health system. And we're going to have to work very hard to gain that trust back again. They've been doing things that are completely antithetical to their mantra of let's go with the science. Science tells us, for instance, that natural immunity works, and it works for more than 3 months. It works for a very long period of time. And, it's only been recently that the CDC has confessed that natural immunity is every bit as good as induced immunity and probably better uh, because it didn't fit the narrative that they were trying to push on people. And, trying to vaccinate children, I mean, give me a break.
Mm.
The likelihood of a child having a real problem with the COVID is 0.025%. That's approaching zero. And you have no idea what the long term effects of spike proteins in their bodies are going to be. And I think that's the reason that only 13% of parents in this country got their children vaccinated. Our people are actually smarter than you think they are. And they kind of look at the thing and they say, I don't think I want to do that to my child. That's good. But we handle it terribly. Hopefully, we will do better this time. As you know, a couple of months ago, they were talking about a new variant that's coming out, and maybe we need to mask up again and get some more vaccinations. And that was met with such resistance, you hardly hear a peep out of them about that now.
That's a very good point. So I think you might say then today we perhaps don't have the necessary minds in positions of leadership right now, as you see it.
We clearly don't. And, that doesn't mean that there isn't hope that they can't learn from what happened before. But I think we need people who don't have an agenda. And we need to have rules that make sense. For instance, to get an EUA, an emergency use authorization, there can't be any other thing that is effective. And that was in place when the pandemic started. And therefore, they had to say that ivermectin and hydroxychloroquine, all these things, they had to say that they don't work in order to be able to do the EUA. If they were smart, they would say, let's explore every avenue, not just have one. And obviously, you'll get to a better answer much faster. You look at the West African coast where they use hydroxychloroquine for malaria prevention. They had 94% less cases of COVID there. That's the kind of thing that should perk your ears up. You can say, what the heck is going on there? Instead of saying, no, this stuff will kill you, it'll give you a heart attack. That I think they really did themselves a lot of credibility damage there.
Mm. And I do think that the willingness of some elected and unelected leaders have overstepped their mandate. At least that's what I hear a lot from AMAC members. And I do think that we need to be careful with our trust because, we're always told, even with the most draconian measures, that government is here to help. And I understand that people want to believe that, but that's not always the case, is it?
Yeah, that's why Ronald Reagan said the 9 words you don't want to hear is I'm from the government and I'm here to help.
Ah, there you go. That's a great quote. One that we can't forget. Absolutely. It's good that people are using their own minds here. I appreciate your feedback. I do want to talk a little bit about individual freedom and self-governance because our members, they're not only concerned for the future of them, their own lives, but their grandchildren, perhaps even their great-grandchildren. So, in an ideal society guided by the principles of the American Cornerstone Institute, what does the landscape in education look like to you here in America? And over the next 10 years, if you were to look out, what does the landscape in education look like?
uh, Actually, it looks pretty dismal. Now, there are some aspects of it that are promising. Homeschooling, for instance, since 2020 has doubled and is continuing to rise. You look at private schools, particularly faith-based private schools, the long, long lines of people waiting to get their kids into these places. So the people actually recognize that there's a problem out there.
Mm.
You look at the public school system, you may be familiar with the Baltimore Project, and they looked at 23 high school, middle school, elementary schools, assessing the ability of students to perform math at grade level. There were over 2,000 students involved. There were 0 students who performed at grade level. And it was done in Baltimore, but we would find the same result in a lot of our public schools in inner cities. The kids are not being prepared. Society is being dumbed down. And that's something that's happened in other societies, particularly before the imposition of government dominance, because you have to have people who are docile and are not extremely well educated. This is a real problem and one that has to be solved. If you look at what was required to get a sixth grade certificate uh, 150 years ago in this country, you would be flabbergasted to see that exit exam. Uh, Most adults today probably couldn't pass it. And we are just dumbing things down, and it's hurting us internationally.
Really interesting that you mentioned that, how that sixth grade exam was so different. My grandfather, he only made it through sixth grade. His father rather passed away. He was the youngest and only boy with four older sisters. So he supported the family. Um, if he was alive today, he'd be about 105 years old. But he was such a brilliant man. He's self-taught. But now I understand when you say that. You just made a real good point there that the education that he did get was very different than how we're teaching our children today, and that's a real problem.
Absolutely.
AMAC members are very concerned about indoctrination. And one question that I've been asking the presidential candidates over the last few weeks is how do we address the education system in America? What, in your opinion, Dr. Carson, should be the government's role in the federal government, that is, in helping establish better education for all Americans? Should it be left up to the states entirely?
I think it should be left up to the states. Federalizing it, I think, carries more danger than benefit. And in the early days, particularly when Alexis de Tocqueville came to America to study our nation because the Europeans were fascinated. They couldn't understand how a nation barely 50 years old was competing with them on every level. Um, and he could find a mountain man in the middle of the forest, and the guy could read, and the guy could tell him about the Declaration of Independence. Uh, it was all of those local one-room schools. That's why the guy could do that. But they concentrated on the basics: reading, writing, arithmetic, the things that you needed to know to function well in society, not, pronouns and gender stuff.
Tell us a little bit, sir, about the American Cornerstone Institute.
Well, when I finished my stint as Secretary of Housing and Urban Development, I said, this time I'm going to really retire. But but
As
it
you
was
research Alzheimer's, right? Among all
uh,
the other wonderful things you do for our country.
exactly. But recognizing how our nation was moving in the wrong direction so rapidly, I said, I'm not going to enjoy myself playing golf all day or sailing around the world or watching all the movies I never saw. So myself and some very outstanding people from HUD put together American Cornerstone, which is a think tank slash do tank. That was the name that Glenn Beck gave us, because we actually do things and we focus on those principles that made us into a great nation. We didn't go from a bunch of ragtag militiamen to the pinnacle of the world in record time by coincidence. It was because of some of the principles that we employed. Number one being our faith, our Judeo-Christian faith, which taught us how to relate to each other. Love your neighbor, not cancel your neighbor, not hate your neighbor if they have a different yard sign. Liberty, the ability to lead the life that you want to lead, the way that you want to lead it, as long as you're not hurting other people. That was one of the reasons that so many people came to our shores from all over the world. And, we are relinquishing that freedom by submitting to political correctness and wokeness and all of these things, just giving up our freedoms voluntarily. And we need to be very cognizant of what that means. And then the cornerstone of community, working together. In the early days of our country, we had communities that existed of 50 or 100 families, no other communities around for 50 or 100 miles. They not only survived, but they thrived because they understood the concept of the common good. In many cases, they could hardly communicate with each other because they were from different languages, but they understood how to amalgamate their skills and talents for the good of the community. If somebody broke their leg during harvest time, everybody else harvested his crops. They didn't say, "Are you a Republican?" or, "Are you Catholic?" They didn't do that. They said, "This is my neighbor. I'm going to help take care of him." That was so important. And then the last cornerstone, life, from the womb to the tomb, respect for life. And as we've grown away from that respect for life, our relationship with each other has become much more coarse. And we need to refocus on those. And then we have a pediatric component called the Little Patriots program, where we, K through 5, teach them the good, the bad, and the ugly about who we were. But the fact of the matter is, the good is much greater than the bad and the ugly. You have CRT and 1619. They just focus on the bad and the ugly, and they try to build everything around that. The United States is so much more than that. And then we have the Executive Branch for America program, which teaches people how the government works, all the ins and outs with interviews with people who've run federal agencies, um, because we want to encourage, particularly younger people, to go into government, but we want them to have a foundation when they go into government and be able to hit the ground running. It takes most people a year, just as deer in the headlights, trying to figure out what the heck is going on. And we want to give them that advantage. You could actually get certified through our online program, free of charge, by the way. All the children's programs and Little Patriots, absolutely free of charge. They're expensive to make, but we've gotten underwriters to underwrite the cost of all of them, because the goal here is not to make money. The goal here is to save our country.
It's wonderful the work that the American Cornerstone Institute is doing. It's so important. And, Dr. Carson, when I opened up, I mentioned our healthcare challenges and our educational reforms that we know need to happen, the ripple effects of a global pandemic. And of course, this backdrop of global conflict that unfortunately, it's impacting every American here today. This is real serious stuff. Before we let you run, and I know you're a busy man, what kind of hope do you have for America's future with all that we're living in today?
Well, as long as there is a God up there, I have hope. Because if he was willing to save Sodom and Gomorrah for the sake of 10 people, we got more than that. So we should have this. But, we have to learn to think, and we have to
Mm,
be courageous. When I was running for president, one of the things that really encouraged me in the smallest little hamlets of North Dakota or Alabama to the largest cities, most people actually have common sense. What they actually lack is courage. People will stand in the corner, stir up their shoe rather than say anything because they don't want anybody to call them a nasty name or risk being canceled. You cannot be the land of the free if you're not the home of the brave.
wonderful. Thank you for leaving us with that. Wonderful conversation. It's always a pleasure to have you with us. We thank you so much, Dr. Ben Carson.
And thank you for being a patriot.
Today's episode is sponsored by Emergency Assistance Plus. Now, your membership with EA Plus provides you with an extra layer of protection anytime you travel. Whether you're thousands of miles away or on a short road trip away from home, you'll have peace of mind should a medical emergency arise. EA Plus membership gives you access to a team of highly skilled professionals, and they will ensure that you receive proper medical care and get fast and reliable transportation home. Get that extra layer of protection anytime you travel. Become an EA Plus member today. Call EA Plus at 800-445-3575 or visit emergencyassistanceplus.com/BFA podcast.
The Association of Mature American Citizens is the conservative voice for Americans 50 and older. AMAC is fighting for the values that you hold dear. Join today. Together, we can write the course of America.